Assalamu alaikum. Welcome to the first episode of Healthwise. Wishing you all a very happy and healthy Ramadan. I'm Dr. Tahira Shahid and you will be watching me for the entire month of Ramadan every day with a new health topic. It has been an entire year dedicated to health. We have been fighting a pandemic and so many more health issues. That is why we have decided that this Ramadan, while you're fasting and while you're waiting for your iftar, why not talk about health and in a fun way so that it's easy for you to understand, not a lot of medical jargon, just everyday talk so we know how to maintain our health and we don't have to keep referring to Google to search for what is best for our health. So today we have with us a very interesting doctor, a very interesting and guest who I would specially like to thank for coming over, because for anybody to come over on the first of Ramadan while he's fasting is really, really difficult. So I'd like to welcome neurosurgeon Dr. Akbar Khan. Welcome to the show and thank you so much for joining us today. And today our report is going to be on what's most common during Ramadan. Actually, it's most common almost every day, and that's headache. So we're going to go ahead and watch what headache is all about. If you've missed your morning coffee and tea, you're fasting, you're getting hypoglycemic, you've been out in the sun too long. What is it that's actually triggering your headache? What it is, let's just watch this report and then come back and meet our interesting doctor in detail.
Headache or head pain sometimes can be very difficult to describe. The location may be in one part of the face or skull, or may be generalized involving the whole head. Basically, headache is defined as pain arising from the head or upper neck of the body. The pain originates from the tissues and structure that surround the skull or the brain, because brain itself has no nerve that give rise to a sensation of pain. A thin layer of tissue that surrounds bones, muscle, that encase the skull, sinus, eyes and ears, as well as thin tissues that cover the surface of the brain and spinal cord, arteries, veins and nerves, all can become inflamed or irritated and cause a headache. Headache may arise spontaneously or may be associated with activity or exercise. The most common type of headaches are tension headaches, migraine headaches, cluster headaches. Secondary headaches can be because of trauma, disorders, infections, structural problems with the bone of the face, teeth, eyes, ear, nose, sinus, or other structures. Changes in brain chemistry may also be associated with headaches. Medication reactions, drug abuse, or drug withdrawal can also cause pain. It is important to consider that an unusual headache may need to be evaluated by a healthcare professional, but in most instances, primary tension headaches may be initially treated at home.
Alright, so we heard all about headaches, and while we know that missing our morning coffee or hypoglycemia or not having enough water can cause a headache, but there was one thing that he mentioned, and he said the unusual causes of headache, and I think that's where you come in, right? So could you mention these unusual causes of headache, and when people come over and tell you that we have this headache, so what are your questions to them?
So the 50% of my practice is actually headaches, and half the patients that I see have had their first presenting symptom as headache. There were some few other headaches mentioned there with different names like cluster headaches or other types of headaches that he mentioned there,
migraines, and then hypertension.
Now they are very different types of headaches, and they come at different times and they last for different times, and they've got different intensity. Sometimes they can be like come and go on the face. There are like hundreds of types of headaches. But the headaches that come to me, they tend to be fairly sinister. They are not settling on medication. And it's not just headaches. With headaches, you tend to get, you start feeling sick, you're vomiting, you're not feeling well. Your headaches don't settle with any medication. If that's the case, then I think you should see a doctor, whether it's Ramadan, whether it's COVID-19,
yes,
whether it's something else.
Because you know what happened in the last year is there was so much of stress on staying home and not going out and infection control that people who were actually suffering from so many issues didn't go out, and as a result they just got complicated it further. So that's a very good thing that you've pointed out. So, and when should one not ignore a headache? Let's come to that.
There are two things, two answers that I would go like for your question. One is that of course, because of the pandemic and everything, that people were under lockdown and all that, and it's all across the globe that people, especially those who've had sinister headaches and they've been ignoring them. For example, having a brain tumor is a major thing, okay? And that's like 50% of my practice is dealing with brain tumors, and they all present with headaches. So if you sit on a headache, which is actually due to a brain tumor, as I said, 90%, 99% of the headaches are not related to brain tumors. But if you sit on a brain tumor and it's growing, then I think you're just harming yourself. So majority of the cancers presentation during the COVID pandemic that we are still going through, God knows how many, I don't know which third cycle is it?
This is the third wave. It's the third wave.
I don't know how many waves
Unfortunately,
we've gone
yes,
through.
Yes,
but
but we're ignoring a lot of our mainstream medicine because of just COVID, and which is unfortunate.
The idea of these programs is, of course, to tell people, enlighten them with the fact that, okay, you've got different types of headaches, you can deal with medication.
So let's tell them, like, you know, usually our people are used to watching this hero in a movie and he goes out in the sun and then he suddenly faints and then he goes for a test and they find out he has brain tumor. So what exactly are the symptoms that we know, like dizziness, or is that vomiting?
So, as I said, I think the producer needs to change these tablets in the background actually, and I don't know which country are these from, these photos. Can't change those. Anyway, headache symptoms, as I said quite clearly, the headache symptoms that are not settling with medication are the ones that need investigations. Okay. First of all, of course, when you come to my clinic, I'll obviously check your blood pressure. Blood pressure is a major cause of headache.
Yes, it is.
You can have like different other conditions, including your, if you've had
hormonal
stress,
headaches,
hormonal
muscles, when you're tense muscle,
your
tension
electrolytes
headaches.
are abnormal, something else is going on, you've had a bad night's sleep, you haven't slept well.
Well, yes, those are the usual ones, but what would you point out?
But the ones that come to me, their headaches not settling, they're vomiting, and of course they get blurry vision. These are the ones that are serious, and then you get investigated. Yes, so the moment you enter my hospital's ER, Shifa International, for example, if your headache is of that sort that you are vomiting and not feeling well, the first thing you're going to get is a brain scan, okay?
Okay.
The moment you get a brain scan, that excludes like whether you've got any problem or not, that is serious.
So when we talk about serious problems, you mean there's a growth like a tumor, or it's something vascular, like for example with the blood vessels or the blood supply? Are those two things
yes,
serious?
There are like,
serious?
so headache is not just brain tumor. There are blood vessel abnormalities, there are brain aneurysms. As I said, 50% of neurosurgery is headache.
Exactly.
I'm dealing with headaches, but the headaches are very serious headaches. So brain tumors can be benign tumors, they can be malignant tumors, they can be tumors that have come from other parts of the body, like metastasis. And then other causes of headaches include, for example, if you've got a brain aneurysm that is ruptured. So if somebody's had a headache, which we say in English, like if somebody has hit you on the back of your head with a cricket bat or something, if you get a sudden onset severe headache
in your back of the head.
And in the back of the head.
And the point is that you don't delay it, because if you delay it, what happens in case you delay it?
If you delay these type of headaches, so for young people come and they've delayed so much. I mean, I had a patient come from I think somewhere in middle of Punjab, and they traveled all the way, and the patient was so delayed that the patient never made it actually out of ER. I decided not to operate on him because I think he'd missed the boat. He would not have survived.
So this is the kind of awareness basically that people need to have, that if they do have a headache, they needn't just ignore it. They don't have to ignore the signs and symptoms, and they have to go in for all the investigations that the doctor has prescribed, right?
But one thing I have to tell you guys, okay, don't come to me with simple headache. I'm a neurosurgeon, okay? So if you come to me, I think the first thing is to go and see your general practitioner, a GP or anybody. I'm sure they work out like basic investigations
Actually, you know
everything.
what, this is something that I've noticed, and it's very rampant here, that people have forgotten that they have to have a family doctor. Everybody should have a family doctor who's aware of your family history, who tells you that these are the usual things, and you know, you don't have to stay dehydrated, you don't have to stay like without any food for a long time, you don't have to go out directly in the sun, you need to monitor your blood pressure and everything else. And if you're tense, you need to actually cure the tension, and then if still not treated and he refers you to a neurosurgeon, that's when you go there, right?
Yeah, and I think having a good family physician is something which does not exist in Pakistan.
Yes, unfortunately it doesn't. People just directly take an appointment with the
I
specialist.
get patients, like even today I saw a patient, he came to me, he said, I've got neck ache, and I asked him, okay, so why have you come to me? He said, I had neck ache, so I thought I'll come to you because I've heard you're a very good doctor. I said, well, I'm a neurosurgeon. I mean, would you expect me to tell you? I mean, you've got neck ache, I examined him, there's nothing wrong with you. I said, go take paracetamol and go walk away. And he was okay with that actually, but I said he should have gone to a physician, family physician.
Yeah, that's because that's the practice. That's the usual practice. The moment they walk in, even in our clinic, they ask you, do I have this super specialty doctor present? And the thing is, they've actually diagnosed themselves. That's very wrong. That's where it starts, right? So when we say somebody is a neurosurgeon, so he's dealing with everything that's connected with the brain, the nerves, and the spinal cord, and he operates in it. That's what you're trying to say, right? So let's come to children. Our children have a lot of presentations. So what are the most common presentations of children?
So children are like, of course, I mean, children are very different as compared to adults in their whole anatomy and the way they present and the diseases that they have. So normally children don't get headaches, okay? I mean, there are children walking around everywhere. They don't get headaches. If a child is saying that the child has got a headache, I think that needs to be taken seriously.
That should be taken
And having
seriously.
said that, just again, I'll mention today I saw a 14-year-old child, yeah, of course, she's a child, and she had headache, and I referred her to a local hospital because she was out of the area, and it turned out to be, her father was a doctor who rang me, and I, like, via appointment system anyway, turned out to be meningitis.
Oh, that is
So
something,
in
yes.
a kid, so got investigated and all that. But first point of contact was the child had a headache, got an appointment with Dr. Akbar Khan, who's a neurosurgeon.
Yeah.
I told him, listen, the kid has got a headache, they need to go to ER
Yeah.
and get examined by a pediatrician. And then I told him, you need to tell me as well what happened. And then he calls me back and says, yes, you, Dr. Akbar, it's some meningitis. I said, anyway, so she got treated and whatever, but in children we need to be careful that if they are vomiting, they've got headaches, they can't see, they can't read properly, they get pressure behind the eyes. That's a serious thing, okay? So I tend to operate on kids as they come, I mean, fairly regularly. I mean, they tend to have brain tumors as well. And
does it affect their vision, their
yeah,
speech,
it does.
their
It does
writing,
affect their vision,
memory,
speech.
judgment?
Yeah. If they are walking, they can't walk normally. If you notice any change, actually mothers are quite good. Good thing about Pakistan, there are many good things about Pakistan, but what I'm talking about in neurosurgery is that overall the disease presentation in Pakistan is very late. But when it comes to children,
The mothers are really...
the mothers are very up to the
Microscopic.
scratch and properly, and the kid comes to the proper diagnosis very quickly.
Okay, that's good.
So that's a very good thing in Pakistan. But patients themselves who are grown up, they tend to ignore stuff, and they are still presenting pretty late. And of course, there is then variety of opinion. I mean, opinion varies. I mean, I do like, for example, brain cancers. I deal with them very differently as compared to most of the people around here. And I tend to be fairly aggressive in terms of taking the tumors out and trying to, because every bit of tumor that I take out gives an extra month to that patient's life.
No, that is very important. And when we read your name out there, it says minimally invasive surgery. That means you don't really burn holes into the skull, perhaps.
No, so
and do
that's
it.
no. So I do different types of surgeries,
Right.
but my major trait is minimally invasive. That basically means I do endoscopic brain tumor surgery.
So let's explain it out to the common man. When he says endoscopic, it means he's doing it via camera, going in there,
Yeah.
not necessarily opening it all up. So you don't have to, feel scared about
But
it.
it's
right?
not every tumor that I can
Yeah.
do minimally invasively, but there are certain specific types of tumors that cause pressure behind the eyes, actually, pituitary tumors, that I tend to do endoscopically, that people don't have a
Can you
cut.
mention a few symptoms of pituitary tumors so people know that if they have exactly these symptoms?
So I'll tell you,
that's when
I came here, I started endoscopic surgery, brain and spine, I started minimally invasive spinal surgery as well at the same time. And just like I think 2 weeks ago, I operated on a patient who had 2 surgeries through the nose, and including one major surgery. Both were done in London, okay? And of course, he could afford it. Not everybody in Pakistan can afford to go and have surgery in London. In the same hospital that I was trained, okay? So he had surgery done in 2013, I think, at that time. He had a brain tumor. 2 surgeries done in London is quite a lot of money, okay? You can buy a house in, I don't know, Bahria, I guess, for that much money. Then he heard of me. Of course, people ask for most things, this, that. He came to me and he said, I want to get, he needed third surgery definitely because he could not see properly. So one of the major things that patients present with is they can't see properly, they get double vision, they get reduced vision. So anyway, he came to me and I operated on him, and later on his son came to me and he said, is this the bill? I said, of course, this is the bill. Usually I don't tend to divulge or go into the discussions of whatever the bill was, but the bill was so less that he was surprised actually. He said, that's very little money you've charged. I said, well, it's a lot of money for a poor person in Pakistan, but for you it's nothing. But considering your dad is doing well, why didn't you buy me a nice Prado?
All right. No, this is very important for people to know that we have very good doctors and we have very good medical care available in our country. And it's not actually necessary to always travel abroad and spend so much and then think that you're actually getting the best treatment. So we have good treatment here. And as I was saying, and as Dr. Akbar was mentioning, it's very important for you to first visit your general physician, get a complete assessment as to what's going on with your body, because your simple headache, that whatever you are experiencing, could be just because of your habits. You could have bad posture, you could have bad sleeping habits, you probably have screen addiction, you're always on the screen, you have a visual problem, you're not wearing the right glasses. So first go and get yourself evaluated and see that all these things are fixed and you don't have any such issues. And still, if your headache persists, then you go visit a neurologist who then runs a series of tests on you, and those tests are like the brain scan. So you mentioned there's a CT scan, there's a brain MRI, and that rules out if you have something growing inside your head that shouldn't be there. But coming to this, there are a lot of people who suffer from migraines, right? And migraine is something that, even when Ramadan started, the maximum people who were searching the question was like, can I fast with migraine? Because it affects with my daily life, my productivity. And migraine is this headache, the splitting headache of half your head. And sometimes it is accompanied with aura or vomiting or hallucinations. And then people keep getting it frequently. Some it correlates with the monthly cycle. For others, it's just triggered by like loud noises, flashy light, whatsoever. So how do you go about by treating migraines?
So migraine is a completely different subject.
Yeah, it is, but unfortunately today's headache, and it's not neurosurgery.
No, I'll tell you, it's a mixed thing anyway. I tend to see patients who've been diagnosed with migraines for years, and it turns out to be they've got the size of like a cabbage tumor in their brain, which I've taken out. So the reality is migraine tends to be, in Pakistan I see that. I think this program should be seen by doctors as well.
Yes,
and you cannot diagnose migraine without a proper MRI scan, okay? So if you are diagnosing a patient who's getting severe headaches which are affecting the quality of his life, I personally think that patient warrants an MRI.
Okay.
And of course it might be just 1% of the time that a patient comes out, it turns out to be a brain tumor, or maybe 2% or 3% or 5%. I'll have to do this survey study in Pakistan anyway, but there is a significant population. So they tend to get diagnosed with migraines, okay, I'm completely against that. In any case, coming back to migraine, okay, if you don't have any brain lesion and it's cleared, then of course migraine has got different types, okay. And they tend to be mainly autonomic. Autonomic means there is another system in the body that controls your pain or fibers and all that, and your perception of pain.
So how do we control these migraines other than avoiding these common triggers?
Mainly there are different things, okay. For example, there are people who get migraine after having coffee, just avoid coffee. There are people who get migraines after watching television, just don't watch television.
Some people give you a headache as well, right?
People give you headaches.
So you avoid those toxic people as well.
But then on top of that, of course, there are other medical managements as well that are happening, including tablets. There are a certain number of tablets.
What's the role of triptans? Because a lot of people abuse these triptans, overuse of medicine.
I don't know anyone who abuses them.
A lot of people get used to it, and then they have withdrawal symptoms from triptans itself.
I don't know.
Rebound headaches as well.
Rebound headaches is a completely separate thing. Actually, as I said, I used to work with one of the professors of headaches, and at one point we would start actually reducing all the medication that a patient is on, because they were getting medication overuse headaches. But that's not that common in Pakistan,
No, it
I
is.
think.
Actually, that is why I pointed it out, because ever since COVID started and the lockdown started, people have this tendency on stating their medical queries on WhatsApp groups and Facebook groups. And everybody, almost everybody and anybody comments there. And whatever they have used, irrespective of what their symptoms have been, they write there.
I'll tell
and
you
then people
something. I
start
mean, in
using it.
Pakistan, I don't think medicine is as regulated. Okay.
Yes, it is.
It's not regulated. Majority of the medicines are available over the counter. And,
Everything is available
I
over the
think
counter.
everybody seems to be like I'm sorry. I mean, I'm also a Pakistani, but most of us think that we are too clever
Yes.
and take medication ourselves. But anyway, coming back to migraine, it's quite a severe thing to have a genuine migraine. Okay, that does tend to affect your life and quality of life whenever it comes. But migraine doesn't tend to be daily. Okay, it tends to come in
Yeah,
cycles.
it does.
So coming back to like Ramadan, we are in Ramadan. So if somebody does have a migraine or suffers from migraine, and he gets a migraine during Ramadan and he cannot cope with it, then it's a different thing. Then maybe he could skip the fast and then keep it later, and that's quite clear in our religion. But if he's not getting a migraine and he's going through a normal thing, I mean, then he could carry on with fasting, I think, because intermittent fasting itself has been proven to be very good
and
for the
they've
body.
said keto diets have helped with migraine a lot as well.
So that is a separate discussion, but that I think goes with, I think as I said, I mean, headaches, backache, leg pain, and depression as well, actually, another one. And during this pandemic, I think, I have to tell you honestly, because of course I was doing clinics differently, and I just went away for a little while as well. I was in London, but I've been seeing patients regularly all the way through the pandemic, and what I've seen is that the number of patients who come to me with depression has increased, even though everybody knows that I'm not a psychiatrist.
Yes, but they probably feel comfortable talking to you.
I don't know they feel comfortable.
We'll continue this discussion, but our producer wants us to wind up now, unfortunately.
Okay, we're going to wind down.
Yeah, so we have to wind up, and we have to tell everybody over here that if you have a headache, first of all, you need to identify what kind of headache it is. And for that, you can always visit your general practitioner and avoid the things that trigger these headaches. And that could be anything from irregular sleep patterns, dehydration, not drinking enough water, not having food for over long periods of time, screen addiction, bad posture, negativity, feeling sad all the time. And in case you do have a migraine that's not getting well, do not self-medicate, do not overuse the medication. Please go by whatever your doctor tells you. There are a lot of supplements out there as well, like magnesium, and there are a lot of long-term treatments as well where doctors, neurologists put you on either beta blockers or whatsoever, but do not self-medicate. Just follow all of that. And if it still doesn't get cured, then we have super specialists like yourself, Dr. Akbar, available here. So you can go up to him, and then he runs these series of tests on you and sees that there is something dangerous.
I will say one thing,
Yes.
which you have said quite correctly about headaches. Headaches can be very sinister.
Yes.
Just think about that. And if they are simple headaches, do not ignore any headaches that are not settling. Do see a doctor. Okay. But of course, only come to me once you've had an MRI scan.
And make sure nobody gives you a headache and you don't give anybody else a headache. So wishing you a very happy first Rosa. See you tomorrow in Healthwise. Thank you for watching. Allah Hafiz.